See, they are sitting over here for the demonstration. We are going to show how the chair ergonomics really plays an important role with your posture, with your low back pain, or with your knee pain, or sometimes even with your heel and ankle pain. So I'm Prachi, and they are my colleagues. We work together. So here, if you are seeing, Yashvi is sitting with her back completely supported on it. Feet are touching down. The angle is different, but she is keeping her knees behind. So ideally, when you sit, it should be keeping the knees ahead. But when we see in Pradnya's case, if she has to keep the knees ahead, they are hanging. They are not getting supported. So she feels like to keep them up on it, and that's how she feels more supportive. But in that, what is happening is she is continuously keeping her knees bent, which will create the tension on the knees forward, and it will make the hamstrings much tighter. So in this case, this is not ideal for her. This chair is not ideal for her. And over here, what do you feel?
Actually, my knees are coming up and I have to come ahead to stay straight. So that is it.
Exactly. And when she is mentioning that she has to come ahead and her knees are coming up, that means there is a too much of a lot more pressure which is coming on the back behind. So as far as her height is concerned, the knees are coming up and the butts are going down. So that is also not an ideal chair for her. So over here, let's ask them, all of them, to get up and come on the side of your chair, and we see that which, just come on this side, we see which chair is quite comfortable with each of their height. Also, there are the seat chair cushions. Then you can put the seat chair cushions to raise up the height, or if your feet are not touching down, better to put the step board or a footrest where you can keep your foot supported. So I would rather say, in her case, she should be going onto this chair. Correct. Pradnya, try to come on this chair and sit. So when we sit, we saw that her knees, back and everything is supported well. Here Pradnya's feet are touching down well, her back is supported well. Yashvi, can you come on that chair? Yeah. But a little bit of, yes, she has that tendency now. It's not that it was going up higher and she was bending it for the support. But in this case, Pradnya might not require the chair cushion. But over here in Yashvi's case, she might require a little chair cushion. Can you get up, please? And then a little back support as well. And now when we see her, she is upright. Her knees are falling down with the hip angle. So now this is a correct ideal chair for them to go ahead with. So this is how with your height, you can change and see how your foot positions to avoid any kind of a low back pain, knee pain, or any kind of a postural pain.